Hello students. So now we're going to discuss precocious puberty. We've already seen the physiological changes of puberty, delayed puberty, and now we come to when puberty occurs before its time. This is known as precocious puberty, and it is defined as any secondary sex characteristic before the age of 8 years or when menstruation starts before the age of 10 years. So what do we mean by secondary sex characteristics? For instance, breast budding before the age of 8 years. So lots of times you get patients who are brought by their parents that breast budding has started before the age of 8 years or menstruation has started before the age of 10 years. Once that happens, the next thing that we need to see is whether this puberty is isosexual or heterosexual. What does this mean? So now we have a patient of precocious puberty. What do we expect? What are the changes that we expect? We expect that there'll be breast budding, there'll be axillary and pubic hair. We expect a change in voice to the female type, and then we expect menstruation. This is known as isosexual puberty, or when the secondary sex characters are the same as the genotypic sex. Sometimes what might happen is that an individual is brought to you that she has started developing changes of puberty which are not in sync with her gender. For instance, she may develop hirsutism, hair pattern in the hair growth in the pattern of male, and changes in voice. So in this case, this is known as heterosexual puberty, or where the secondary sex characters are opposite to that of the genotypic sex. Now that we've decided that it's isosexual puberty, heterosexual puberty will be dealing later. First, let's discuss isosexual puberty, wherein the changes are same as the genotypic sex. What are the reasons? Some of the reasons can be classified as those which are dependent upon GnRH. For instance, let's say hypothalamus and pituitary gets activated before time. So hypothalamus has started secreting GnRH in a pulsatile manner. The pituitary has got stimulated and the pituitary has started secreting LH and FSH before its time. Obviously, there'll be secondary sexual characters and sometimes even menstruation. This is known as constitutional cause of precocious puberty, which is most common, wherein you don't know why the hypothalamus and pituitary have become, let's say, activated before their time. Sometimes it could also be some CNS cause, such as some congenital lesion, trauma, head injury, some infection such as tuberculosis or encephalitis, some degenerative process which is occurring in the brain, or some neoplasm. So what they are doing is they are irritating the hypothalamus and pituitary and causing them to secrete GnRH in a pulsatile manner. Hypothalamus secretes GnRH in a pulsatile manner and pituitary to secrete LH and FSH before its time. Alright. Sometimes primary hypothyroidism also could be the reason for stimulation of the anterior pituitary and production of LH and FSH before its time. In all these cases, the cause is central. It lies in the hypothalamus and pituitary. Therefore, we say that this is a central cause of precocious puberty, or true precocious puberty, or GnRH dependent precocious puberty. Then we have some other causes which are not GnRH dependent. So they are GnRH independent. We also call them the peripheral causes. What could be these? For instance, imagine there is tumor in the ovary which is secreting estrogen. What will this estrogen do? This estrogen will go and stimulate breast development. This estrogen might also lead to endometrial thickening, changes in the voice, and you can have a child who actually has an ovarian tumor brought to you for precocious puberty. So what can be these tumors? It's very important to know what are the estrogen secreting ovarian tumors. So you can have a granulosa cell tumor. You can have theca cell tumor also. But sometimes some of these tumors, they might also secrete androgens. In these cases, when it is the androgens which are being secreted, the lady might have heterosexual puberty. For instance, some of the theca cell tumors might be secreting androgens. The Leydig cell tumor also secreting androgens. Androblastoma also secreting androgens. In these cases, although the puberty will be precocious, which means that the secondary sex characters will be appearing before the age of 8 years, but the secondary sexual characters will not be in sync with the genotypic sex of the girl. Then we can have tumors which are there in the adrenal gland. Again, they'll be secreting androgens. We can have some cases of adrenal hyperplasia. Again, they'll be majorly secreting androgens. Therefore, the adrenal causes of precocious puberty will again, most of them be heterosexual. Then we can have hepatoblastoma from the liver, and sometimes there can be some iatrogenic causes also. For instance, you are giving estrogens to the girl, exogenous estrogens. That's going to do the same thing that an estrogen secreting ovarian tumor is going to do. Or sometimes you can have androgens which are being administered. So this was being done with athletes long time back, German athletes. They were being given in Olympics to these androgens so as to help them in muscle building and win the Olympic medals. But what these androgens did was they caused irreversible changes in voice, in the psychology of patients. They built hirsutism, depression. So finally, these drugs, they came to be banned and they were no longer used. So back to the central causes. As we discussed, there is premature activation of the hypothalamic pituitary ovarian axis. Could be different causes. 90% of the time it is idiopathic. So constitutional causes or idiopathic causes are most common. And sometimes we can witness some brain tumors. Therefore, it is mandatory to always do MRI of the brain and see if there is any tumor, craniopharyngioma, which is pressing upon the structures, the hypothalamus and the pituitary, and probably causing them premature activation of the HPO axis and precocious puberty. Increased LH and FSH is diagnostic of central causes. Why? Because actually it is the hypothalamus and pituitary, and finally LH and FSH secreted by the pituitary, which are responsible for the secretion of estrogens. So LH and FSH is the hallmark. Raised LH and FSH. There will be increased estrogen, obviously. And due to the increase in estrogen, puberty is always isosexual. This is a very important point, that central causes of precocious puberty are always isosexual. Always. So 90% of the cases we have constitutional or idiopathic precocious puberty because of premature activation of the HPO axis. Please remember that bone maturation is accelerated, which leads to premature closure of the epiphysis, and therefore we have these patients who have a short height. Most common cause of precocious puberty is constitutional, and the management is administration of GnRH in a continuous manner, because if you remember from the earlier classes that when GnRH is secreted in a pulsatile manner, it activates pituitary. When GnRH is secreted in a continuous manner, it does not stimulate pituitary. Therefore, when we know that pituitary is being stimulated before its time because of premature activation of the hypothalamus, we give continuously GnRH to downregulate the pituitary. Then different CNS lesions which can cause precocious puberty. Again, they'll be causing central precocious puberty. So it could be some inflammation of the brain, meningitis, encephalitis. It could be craniopharyngioma, neurofibroma, any other tumor of the hypothalamus and the pineal gland. Peripheral causes of precocious puberty could be isosexual and could be heterosexual. It depends upon what is the type of hormone which is being given to the patient or which is being secreted by the tumors. So if it is due to exogenous production of estrogen, obviously the puberty is going to be isosexual. Sometimes it could be because of increased androgen, in which case the puberty would be heterosexual. Whenever you have these cases wherein there is peripheral or secretion of hormones or exogenous administration of hormones, there is a negative feedback on the hypothalamus and pituitary, as a result of which LH decreases and FSH also decreases. Therefore, the hallmark of peripheral causes of precocious puberty is a decrease in LH and FSH. McCune-Albright syndrome. What is this syndrome? So going back to the slide, the ovarian causes. One of the most important ovarian causes, McCune-Albright syndrome, and it is a very, very favorite question with the examiners. So McCune-Albright syndrome, you can see that these lesions, these are lesions, discoloration of the skin which is present, and they have jagged borders. They are known as jagged coast of main borders. Importantly, these lesions, they respect the midline, they stay one side of the midline, and also associated you find areas of polyostotic fibrous dysplasia. In McCune-Albright syndrome, again there is sexual precocity, which is due to early and excessive estrogen production from the ovaries. Therefore, we have isosexual puberty. Please remember, McCune-Albright syndrome is a very important cause of isosexual puberty. You find multiple cystic bone lesions of polyostotic fibrous dysplasia, associated other endocrinopathies like hyperthyroidism, hyperparathyroidism, acromegaly. These spots, these are known as capiolae spots, and there is a lifetime increased risk of malignancies. I have seen McCune-Albright syndrome being asked in different forms. For instance, it might be asked whether it causes isosexual or heterosexual puberty. Is it a central or a peripheral cause of precocious puberty? So again, it's a peripheral cause. The cause is the stimulation of the ovary, and it is characterized by capiolae spots and polyostotic fibrous dysplasia and precocious puberty. Now, these are some isolated instances wherein you can find just premature thelarchy. Only isolated development of the breast tissue before 8 years, not followed by menarche. Sometimes you can have premature pubarchy, which is isolated development of axillary and pubic hair. But it is not associated with thelarchy, it is not associated with increased growth spurt, and it is not associated with menarche. Or at times you can have simply premature menarche, which is again an isolated event of cyclic vaginal bleeding without any other signs of secondary sexual development. And the cause is undue sensitivity of the endometrium to the low levels of estrogens. So although the level of estrogens is low, still the endometrium is somehow more responsive to these low levels of estrogens, as a result of which there is menstruation, though there has been no pubarchy, there has been no thelarchy, there has been no increased growth velocity. Now let's do one very important question. The most common cause of precocious puberty. So it's idiopathic, the most common cause, we all know. And in the different causes which are given below, let me just discuss a couple of things. So McCune-Albright syndrome, you will have isosexual puberty, precocious puberty. Granulosa cell tumor secretes estrogen, again isosexual. Normal development of the skull, it will cause central precocious puberty, again isosexual. McCune-Albright syndrome will be a peripheral cause. Granulosa cell tumor, again a peripheral cause. Gonadoblastoma will be a peripheral cause, and it will lead to heterosexual puberty because of secretion of androgens. So these are the important things which I have highlighted regarding precocious puberty. All the best. Thank you.